Okay, welcome to part number 3. We will now enter right into the clinical practice of Dr. Brody. A woman who suffered from Hodgkin's disease, cancer in the lymph glands, came to his office and requested psychotherapy. She had refused radiation and chemotherapy, which had been offered by Sloan Kettering Hospital. During the treatment that lasted for quite some years and was conducted on an intensive basis with several sessions a week, during this treatment she developed and expressed very strong feelings of hatred directed at Brody. He described how she seemed to experience a relief from symptoms connected with Hodgkin's, as she was able to, in the transference, discharge these quote-unquote negative emotions. When she would return to reasoning, reasonable, intellectual, rational behavior, the physical symptoms returned. She would develop a fever, her glands became swollen, she would experience abdominal pain. One year I attended a national conference in New York City. During this conference, the patient who started treatment with Brody as she was suffering from the Hodgkin's disease was briefly mentioned as she was known to people in the audience. This was 15 years after she completed her analysis with Brody. According to several persons in the audience, she was still free from her disease, and according to Dr. Brody, she never touched chemotherapy or radiation treatment. This presentation deals with interaction between mind and body. Freud envisioned the future neuroscientific research. Freud envisioned that future neuroscientific research would provide us with reliable information about the quote-unquote real structure of the mind. Brody was also hoping that the understanding of psychosomatic conditions would widen with the help of biological science. He spoke about how the immune system could become subversive and thus attacking the tissues and cells and killing them, a kind of suicide taking place within our own body. The cancer cells, however, do not die. They are quote-unquote immortal. This phenomenon has been explained by a segment of our DNA called a telomere, which protects the cells from dying. What kind of a sick cell is that which lives on forever? Brody asked, not without emotion. I am asking myself, what makes a person take on this kind of battle? Trying to find a cure for the most severe conditions, whether they be organic, psychosomatic, or both. During our transatlantic conversations, I got a sense of the personality of Brody. I was very impressed by him, as I have been only by very few. Some people just have it in them, I guess. He was not primarily driven by prestige or status. On the contrary, I sensed a deep, honest concern for all matters of humanity. and it was real. Okay, so I will stop soon. Even if by doing so I have not touched on other topics that he addressed, I will just list a few of them. Object loss, the greatest stress of all. NAO and conversion hysteria as a psychosomatic condition. Norman Mailer's famous words and their implication. Cancer is madness denied. Transference as the most influential phenomenon in all mental and psychological treatment. Adaptation versus abnormality and pseudo-normality in connection with health, disease, and cure. A plea for a measure of abnormality, the title of a book by Joyce McDougall, well known in the field of psychosomatics, psychotoxic patients, psychotoxic families, psychotoxic doctors, who favor the illness, not the health of the patient, the latter being very closely linked to what we call iatrogenesis. These topics are all very interesting, and maybe we can come back to them in future presentations, as the area of psychosomatics is a very interesting one, since psychological treatment always deals with both the body and the psyche. Please feel free to contact me by email or telephone, and I welcome you to visit me at my websites, which are onlinepsychotherapy.se and psychotherapyforartists.com. The latter is also an online website as the first one. Okay, hope to have a visit from you soon. I will be very happy to know what you think, and thank you for listening to this presentation. Bye for now.